your lab coats. Okay, so make sure that you guys do that. Right now we're in the learning process and we're like doing the little curve where you guys are learning all of this, but for next semester we expect you guys to do all of this, okay?
Alright, so the first thing that you do is exactly what you did. You wipe down the room. I normally go ahead, like I said, and go ahead and scrub my hands. Get that knocked out. Then I go to the board. You guys don't have the board up yet, but we will have that implemented. We were doing it for C2. So you guys will have it. You'll come in, you'll see where you're at. You'll see what room you're in. You see, I'm already getting excited. I'm gonna have to calm me down. Next thing that I do, I look on my surgeon's preference card because I know that I'm going to be doing an inguinal hernia. How do I know? Because it's on the board. I come in. These surgeon's preference cards are your Bibles, like I mentioned. I'm looking through with inguinal hernia. The cool thing is, right now, that's your case card. This is going to be on every case card that comes to you, so you don't have to worry about it. But I know that just in case they didn't have it, the night text didn't do it. But you will get that. Then grab my inguinal hernia case card, okay, or my surgeon's preference card. Then go to my case card and I'm checking, I'm verifying. I'm looking to make sure that I have my right instruments, my right pack, basin, and any other little things that need to be up, whether it's sutures, bovies, any ancillary stuff that the surgeon wants. Once I've done that, then normally you and your circulator are going to work together. You're a team. We have the chart. We want you all to go ahead and fill this out. Just to give you more practice, okay? You never know. You may be somewhere where you are the circulator. So being able to know how to do this and how it works is perfect. So let's go ahead and fill it out. We're looking at the patient's chart. Date of the procedure. Today is 11/16. 2020. Patient allergies. We're going to look to see what the patient's allergy is. Patient's allergic to fruit. Luckily, we don't provide fruit in the OR, so they're safe. Medical identification number and medical record number are the same. In this case, we're looking at 47833028840. Patient's name is John McCain. John McCain. Date of birth. He was born. He was born. All right. So this one says bowel resection, but like I said, we're doing the inguinal hernia, so I inguinal hernia. And then here, allergies. You're just putting fruit. Ah! I just bought this jacket, so I'll be upset if it works. All right, and then of course your surgeon will say, give me a surgeon's name that you guys like. Give me a name.
Collins.
Who?
Collins.
How do you spell that?
Collins.
Oh, okay, Collins. I thought you said something else, so I'm not gonna. What I thought. All right. So then we've got this down. The other thing that I would probably look for if it's a female, making sure that they have taken your analysis and that they are indeed not pregnant. Okay? Surgeons and the patient, everyone has signed it. At that point,
Don't you put the procedure up there?
huh?
The procedure?
Yes. So that one says bowel, but we're doing a hernia repair.
And the patient's name?
Some of them do, some of them don't.
Okay.
So if there's a spot for it, yes, we do. If there's no spot, you just keep moving. That was a great question. Depends on the facility. A lot of facilities will have the patient's name right here, allergies, weight, because you have to have that, yes.
And do we put the whole patient name or do we put just the last name?
Just the last.
So sometimes they just put the first initial and the last name
Okay.
for patient privacy.
Yeah.
Okay?
Okay, so now I'm in my case card. I've got my surgeon's preference card. I've checked it through. Other things with this, we're moving stuff around too, right? So I'm grabbing my ESU unit. I'm gonna put it where the surgeon needs me to place it. So I'm gonna grab the ESU/Bovie machine, and it tells me right where they want it. Okay, foot of the bed. So I'm gonna go ahead and place that. Have it ready, so the surgeon doesn't have to worry about it. If you want it suction, I put suction there. Depending on wherever they want it, this is the time to do it. I'm also checking my equipment, making sure that my equipment works, making sure my bed works, goes up and down, making sure the suction turns on. I do noises, don't freak out, okay? Making sure the Bovie turns on. Up, down, up, down. How are my lights? My lights working good? Does my kick bucket have any thing in it? Good, no. What goes in the cute bucket? Sponges only, no trash. I see trash and I'm not touching it, but you don't want to put any trash in there, okay? I'm also checking to make sure that my trash can has a liner in it. My linen, if we have linen in here, it's outside. Make sure the linen has a liner in it. And we're just checking everything because we want to make sure that we have everything in order before that surgeon-patient team comes in, all right? So we've done that. You guys have to slow me down if I'm going too fast, okay? Then I'm just gonna start placing my items over there. There we go. So, now I'm gonna start placing my stuff where I need it, okay? This is all coming from the case cart. One thing that I like to do as I'm doing it is I'm checking the integrity of my packages while I'm placing it. Knock out 2 birds with 1 stone. While I'm setting it up, let me check it. Knock out 2 birds with 1 stone. Remember, I work for trauma, so I go on trauma, so you guys have to slow me down. I go in automatic mode. Per the book, I gotta talk about it. Per the book, per NVSTNA, you open up your instruments on the prep stand. Per the book. Real world, we tend to use anything we can find, but per the book. This is a question I promise you on the test. I promise you it's on your CST. Prep stand, prep stand, prep stand. As long as you know how to separate the two, you're good. Where do we open up our instruments, guys?
Prep stand.
There we go. Per. Okay. Also, I have my camera, so I'm trying to make sure I get everything in order. But what is one thing you also notice I'm doing? Spreading it out, moving it out. And I'm opening, scanning. Okay? Where do you open up your gown and glove? Oh, hey. Oh. Hey. All right.
Probably has one.
So now I'm opening. Watch my movements. Remember I was telling you in class, make every movement count from the start to the finish. Corner, bottom. Now, you see things can move, right? Just make sure they can see it. So, same thing, okay? With this, your movements are going to be a little bit different. What did you guys notice I did?
You touch it without, well, you contaminate.
Did I?
Well, you're supposed to grab by the linen, no? By the other side.
So how did I do it?
You did it on the,
So did I contaminate?
well, no, you didn't contaminate.
Bam! I didn't.
Yeah.
But this is the cool thing. In the operating room, if anyone ever doubts you, you change it. One thing that we do in the operating room is we lean on the side of caution. So if you at any time thought I contaminated anybody else, I'm gonna change it. Because at the end of the day, it's not about my pride, it's about that patient. Okay? So, cool. Now, my instrument set. The other thing you'll notice is as I open up stuff, I shrink. In the operating room, there's going to be, you guys might have to, let me get it closer. There are going to be little, do we have one? No. Indicators on the side to show that sterilization has been met. I'm gonna pop those. Okay. One thing that I love to do when I'm opening up my set, I like to keep my eyes on my field. Not that I don't trust y'all, but up and over. Let me show you that again. The other thing that I'm doing is I'm checking my filters. I'm holding them up to the air, making sure that there's no holes, no puncture marks, no anything. Okay, there's no water marks. Everything is good to go. So I'll place that underneath there. I'm gonna place it here for now. Then I'm gonna put it in position so that when I'm ready to grab my instruments, I can grab them. It's not gonna be as close to my table because there's no barrier. Okay? Last thing I'm gonna do and I'm gonna bring it out so you guys can kind of see, is open up my gown and glove. This is a dust cover. Get rid of it. Now, when you go to open it, so I make sure I can see it. So I'm gonna move it here so you guys can see me. So the first thing that I did, opened away. And then your gloves. Okay. Now, normally I would move it back here, but I want you guys to kind of see, okay? So, you notice, back table first, basin, instruments, gown and glove, okay? Will you please watch my sterile field? I'm gonna go avant-garde.
Yes.
Thank you.
That one? You took another
Pants. Oh, no, pants. Right here, right here. Thank you.
So, I'm not wet, right? If I was wet, I would grab this, and so I'm just gonna show you if I was wet. I'm not, but I really think that's important for you guys to know how to do it. See my stance, I'm gonna over exaggerate it. One, you guys remember and be like, she's a hot mess, but I ain't gonna mess up. Okay? Now, I'm over exaggerating, right? But how many of you guys are gonna forget? Once again, doom underneath.
You don't do that.
I hope not, don't do that.
Don't do that. Don't do that.
So, this has fluorine in it.
What's your bag?
Thank you. So, what we're looking for, when you guys are wet, you'll see 2 wet spots. That's what we're looking at, okay? So, repeat, boom, underneath, boom. Please not toss anything on the floor. That's a huge
Yes.
no-no for text. So now, a lot of people are like, oh no, my gloves are on top of my gown. Okay,
You see the pinch?
do it again.
Pinch. Pinch. Oh,
Hold on. Put where they were.
pinch.
I'm good at editing, don't worry.
Pinch. There's no grabbing. Okay, it's just a pinch.
So now, if you notice, I have here and here. So what I normally do, and this gown is really big, is I'm also watching, because when I put my hands through, I do not want to contaminate.
Now you see me watching. You see? There's a difference, right? You wanna help me? And this is what the circulator would do too, to help. Just move things over without contaminating, because we're also have to be aware of everything.
I'm not gonna wait for her to tie me up. I'm gonna go ahead and start gowning and gloving.
Hold on, they can't see you.
Okay, hold on. As soon as she does it, then I'll turn around so you guys can see.
Pull in.
I was just exaggerating, wasn't
Yeah, I
that
wasn't done that.
bad? Okay,
I saw it.
see?
I was watching.
Just in case you didn't know.
So while she was gowning and gloving me, I'm gonna go ahead and get my gloves, because time is money and money is time. And we care about the patient too, right? So, if I was to do anything like this, contaminate it. Anytime your fingers go past the cuff, it's contaminated. So, when you gown and glove, I know this sounds crazy, it's hard, but this is how you're gonna wanna do it. I'm OCD, so I like to straighten everything out, and this doesn't take a long time, okay?
I am too. You become OCD in this world.
I see my thumb, I want my thumb to go to this thumb, right? And I've had to slow down because in the past I was told, you go too fast, I didn't see. Once again, here's my thumb, here's my thumb. And remember, I just graduated in October of 2000.
So what did she do wrong there?
She put her hands up.
Yes, thank you. These are the things that you guys should be able to identify, okay? These are the things that will make you a great tech, okay?
Same thing.
But it's fun. What she's doing is fine. You can't do that. And you will see surgeons do that.
Yeah.
They're not trained the same. That is why we have a profession now that actually does all of the things that are correct.
So, there's a couple ways this can get removed, all right? As students, it's not good for you guys to grab it. It really isn't until you get comfortable and we feel safe with you able to grab it. You'll see a lot of techs go like this, okay? I'm not sure how you feel comfortable at this stage. Once you get later, perfectly fine. Normally, can you grab my stuff for me?
Sure.
Thanks.
This is the circulator's job, okay, to help. You saw me clean up? That is what the circulator does because they gotta get ready for that patient.
How did we spend? Did I go around in circles?
No.
So I'll take it, hand it to her, kind of keep my stuff where I need to be. All right? Now,
Do you see her using her feet? That's your hands when you're sterile. Okay? Unless it's blue, you don't touch it.
first thing I want to get sterile is my.
Is that the big one?
Oh, yeah.
It's folded right. You just have to make them bigger.
Okay. So I always open it on my back table and then bring it over just to make sure I don't contaminate. When this comes through, okay? You're going down. This is upside down. But one thing that you don't want to happen is it to come up or fall down. Okay? So we're just gonna keep it moving like it wasn't upside down, right? And then I automatically, no matter how big or small.
What do you think is important? Neatness, right? So you need to fix it so it's neat. Everything needs to be neat. And I can tell you that if this happens to you, it's okay. It's not the end of the world. But if it's backwards, it's fine, okay? As long as you have it covered with a towel, you will be fine, okay? That blue thing that's on top is just reinforcement, okay?
So next thing that we concentrate is keeping these doctors out of our business. So we're gonna give them drapes. So I try to make it real. Like, what's the next thing? I don't want them in my face. I don't want them talking to me like that. Let me go ahead and get my drapes together. So what do your drapes consist of? Down sheet, 4 towels, and then your regular drape. Okay? And you're moving with consistency. If you have time to do this, perfect. One away. One thing that you'll notice is I'm watching my table. As I'm putting everything together, I'm watching my table. Boom. Now, the next thing I want to do is what? Reinforce, okay. What am I reinforcing? What's the next thing I need to get on my table? Instruments. Another thing is to always prepare yourself. What kind of set is that? Minor?
Yeah, it's a minor set.
Perfect. And then just let me know what we're up to, because I'm not sure you said up until this
We
is
can
all
show
new
them
stuff,
the whole
right?
thing. That's
Okay.
fine. And then they just need to get to that point. So what do you need?
So I'm looking in here for my indicator. I see my indicator has turned. The other thing that you guys must put in these sets are count sheets. That way when I see that the count sheet should be here, I'm gonna hand it to Ms. Jimenez, who is my circulating nurse. That's gonna be something else that we definitely have to have. So we're gonna work on making sure you guys
We're
got
going
count
to get
sheets.
it done. It's just, it gives us a little bit. But listen, if the circulator is not in the room, what is it that you do? You leave it somewhere for them. Or you keep it until they actually ask for it, right? So now I'm going to check for the filters. All right, I'm checking. You see how she's keeping it away from herself and just lifting it up? Okay. Checking. What are we checking? The filters for what? And here, in here, there should be no what? Moisture. Okay? You're good.
Thanks.
And now the circulator will take this and put it in the case card, but we don't have it.
Another thing that I tend to do is, if you notice, when I pick this up, I got myself in position. So then when she said it's good, all I have to do is pivot and drop. So let me show you again for the camera. You guys got that? Pivot and drop. Then from here, my next thing is to get everything ready for my count. I am a minimalist, but you guys, there's certain things that you guys have to have. You have to have a towel on your mayo stand. So I'm gonna bring this out for test to teaching. You have to have a towel here. You are required to have a towel on your mayo stand. These are little points that can just, they're points that can get deducted. They're not gonna fail you, but they add up. So I shouldn't even say that. They add up, okay? Next, so for me, so you guys got that, right? Towel, boo, that's right. All this extra moving is really bothering me, but I get it because I'm teaching. The reason I say that is because I don't like to move all this. I like to move and go. And don't be doing all that, right? So, next thing I'm looking at is my sharps because I got to get my count ready. In the real world, you won't see stuff like this, but just keep that in mind that we're training, so.
We're gonna try to keep that better.
Yeah.
So just
Bear with us.
bear with us.
I move with a purpose. I start putting stuff where I know it's going to be needed. Okay? For my sutures, remember I was telling you guys about those free ties today? This is not a suture. It is just free ties. There's no needle attached to it, but it's still very important. Sutures. See, this is empty, right? Stuff we need to look at. Okay? You know how they do on YouTube. All right? So right now, I know that at least I have 2 in here, and then a lot more.
So in reality though, do you have sutures in the pack? Usually. No. Sutures don't come in the packs.
Oh, you mean in the base? Okay, I thought you meant in that pack.
No. They'll come in the packs that they're in
Yeah.
for the sutures, but they will not come in the basin for you guys. You'll have to pick them. So that is why you have a preference card, okay? For purposes right now, we have them in there, but we will let you know if they're gonna be in there in the future, okay? Because for practicing, we have them, we have, our other cohort, but for now, just know that in the future, in the real world, you won't have them in your actual pack.
I'm actually ready to count at this point. You're probably like, but you're not all the way set up. I know, but I'm ready to count.
All right, you ready?
I am. And you have my
Efficiency,
instruments.
right? So now on the circulator. All right, I'm ready.
Ray tacks. So, a couple ways. Yes?
It's not filament.
Oh, it's because it's on there. Real world, I would probably do 1, 2, 3, 4, 5, right? But we want you guys to be able to, we need to know that you know, that we know that you know. Okay? Right? So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
10 Raytex.
Lap sponges. I've got 1, 2, 3, 4, and 5. Why do you think I'm looking?
5.
Because if this didn't have this, then it would just be a regular sponge, right?
I just want to implement something. So these laps will not always look just like this. They'll have rings sometimes on them. So that is another reason why we always check for the actual little tail, because those rings are actually countables as well. Okay. And the other reason that we actually are showing you to do it one by one is because the circulator and the scrub need to verify the count. Okay. All right.
Sutures.
Sutures.
I've got 1, 2.
Okay.
There's 3, 4, 5, 6.
6 sutures.
6 sutures.
Okay.
Hypos. I've got 1, 2.
2.
Blades. 1, 2.
Okay.
Bovie tips. I only have 1.
1 Bovie tip.
Uh-huh.
Penrose.
Make sure you always know where your stuff is. Penrose, but he said we weren't using it. I'm keeping it on my field. No peanuts.
No peanuts.
So, patient's not in the room, right? In theory, can I get rid of that Penrose that we don't need?
Yeah.
and not put it in account part of the count, right?
Yes.
Okay, just making sure you guys know. The other part is that you guys have to do instruments.